Annie. My name is Kate. I'm going to be your nurse today. So the doctor wants me to change your wound dressing, okay? How is that pain medication working that I gave you a half hour ago? Pretty good? Could you rate your pain on a scale of 1 to 10 for me right now? Okay, it's about a 2. Perfect. So we're just going to take off the old dressing and then we're just going to put in a new one, okay? Do you have any questions for me before I get started? Okay, but I'm going to check your name and date of birth here, okay? Can you tell me your name? All right, and your date of birth? Okay. Well, I'm going to go wash my hands and get some gloves, and then we'll get started taking off the old dressing, okay? All right, Annie, I'm back. We're going to get started changing that old dressing, okay? How are you feeling today? Good? Awesome. I'm going to raise up the bed here, okay? All right. I'm just going to pull these down, okay? Just to expose your wound here, okay? I'm just going to drape a little towel over this area, all right? Just for this video so you can see, I'm going to pull the covers all the way down, but I normally wouldn't do this. All right, Annie. I'm going to take off this old pad here, okay? But I'm going to grab my garbage bag here. I'll just set that between your legs, okay? All right. So I'm just going to hold the skin down, and I'm going to peel off these pieces of tape here, okay? You let me know if this hurts at all. And I can see that there is no drainage on this ABD pad, which is good. So that can be thrown away. There is also no drainage on these 4x4s. All right, Annie, I'm going to take out the gauze that's in the wound now, okay? This might pull a little bit, but you let me know if it's really painful, okay? All right. Now I can observe the wound. There is not an excessive amount of edema. There's not a lot of swelling. You can see that there's granulation in the wound bed. It looks red, moist. Everything looks really good. I don't see any signs of infection. So that looks great. All right, Annie, I'm going to take off my gloves now, okay? I'm going to measure your wound, okay? So I'm going to go right down the middle of the wound. That appears to be about 19 centimeters long and about 3.5 centimeters wide at its widest point. I will assess for depth when I actually put on my sterile gloves. All right, Annie, I need to set up some sterile gauze and things here to get started with putting your new wound dressing on, okay? So I'm going to get everything set up here. I need 2 packages of 4x4s. One will be my dry, one will be my wet. This is sterile gauze. So I'm not going to touch this till I have my sterile gloves on. I have a sterile ABD pad. So I'm going to open this, then use the sterile inside to grab, pull this away, and then I can lay it out, making sure not to touch anything else. All right. also going to open my cotton tipped applicators here. What I'm going to do with these is I'm going to pick them up by the very end of the stick, and then I'm going to put them inside my dry gauze so that way I can use them and pick them up when I have my sterile gloves on, since I don't have an assistant right now. I'm going to pour a small amount of sterile saline. After checking the expiration date, and this was a new package, so I just opened it. And then I also have my tape here, which I'm going to get ready once I find the end. I would normally use 3 pieces, but I just ran out of tape. Alright, Annie, I'm going to put my sterile gloves on now, okay? So while I do this, make sure that you don't touch your wound or anything like that, okay? Alright, so I'm going to put on my sterile gloves now. Alright, I can get rid of that. Alright, Annie, I'm going to cleanse your wound now, okay? So I'm going to take one of my wet 4x4s, and I'm just going to wrap it around my finger, like so. Now I'm going to go to the side of the wound farthest away from me, go down, throw that one away. The side of the wound closest to me, throw that one away. And then the side of the very middle of the wound. Alright, Annie, I hope that doesn't hurt. Alright, so I'm going to take this, and then I will check against my measurement here, making sure not to break sterile field. That's about 4 centimeters deep, so that can be thrown away. Alright, Annie, we're going to start packing your wound now, okay? So I'll take a wet 4x4, stretch it out like this. I'm going to coil the excess part of it in my non-dominant hand. And then I will take my other sterile cotton tip applicator, and starting from the side farthest from her head, I will begin packing the wound. I want to make sure that the rest of my gauze doesn't touch the skin around it. You let me know if this hurts, okay, Annie? I'm going to do a single layer all the way to the top, and then we can curve back. And just keep going back and forth. I'm trying my best not to let this gauze touch any other part of the skin. Alright. It appears one piece of gauze got it level, so I can throw my cotton tipped applicator away. Does that feel okay, Annie? Alright, good. So now I'm going to take a dry 4x4. now I can pick up my ABD pad. I want to make sure to hold it by the blue line on the outsides, not touching the inside. Alright, Annie, I'm just going to put this on here now, okay? And then we can tape it on. Does that feel comfortable? Okay, good. Throw this away. I'm gonna remove my garbage. Throw that in the trash. I'm gonna take this towel off now, Annie, but I'll pull your gown down first. That can go in the linen hamper. Pull your sheets back up here. Here's your call light, okay? Can you reach that? Yep, okay. I'm gonna lower your bed. Do you want the head of it raised at all? No? Okay. Alright, Annie, are you comfortable? Do you feel any pain now? Can you rate it for me? Still at a 2? Alright. Sounds good. Is there anything else that I can do for you? No? Alright. So I'll remove my gloves now, perform hand hygiene. I would perform hand hygiene anytime I remove my gloves, in case I did not verbalize that prior. I will clean up my area, and then I will document the wound characteristics, the type of dressing that I use, which is a wet to dry dressing, and what her pain was, and I can wash my hands, and I am done.